Assalamu alaikum friends. So this is me Dr. Barira Javed. Today what we are going to discuss is ABGs analysis. As you know that interpretation of ABG is very important in our daily routine medical practice. So you must be knowing that there are five components of an ABG. First is the pH. The normal range of pH ranges from 7.35 to 7.45. Then comes PCO2, which has range from 35 to 45 millimeter of mercury. Then bicarb, which ranges from 22 to 26 millicoulombs per liter. PO2 is from 80 to 100 millimeter of mercury, and saturation is between 95 to 100%. So this is a normal ABGs. Now, whenever there is any respiratory or metabolic derangement, then what happens? For example, if there is respiratory acidosis, so what happens in that? PCO2 increases because of respiratory acidosis. The cause of respiratory acidosis can be any asthma exacerbation, any pneumonia, or any respiratory infection, which causes increase in the PCO2 because patient will not be able to exhale properly, especially COPD patient or asthmatic patient. So when PCO2 increases, it decreases the pH. That is called as respiratory acidosis, as we mostly encounter in the patients of chronic obstructive pulmonary disease. Then there comes respiratory alkalosis. It is usually due to hyperventilation. Base PCO2 decreases, as a result of which vice versa pH increases. So this is called as respiratory alkalosis. Metabolic acidosis is when bicarbonate decreases, as a result of which PCO2 decreases. So you can see that the two most common causes of decreased pH, that is acidosis, are increase in the PCO2 and decrease in the bicarb. This decrease in the bicarb could be due to uncontrolled blood sugars, decay. It could be due to any acute gastroinfection, or any it can occur in a patient of AKI or chronic CKD patient. Then we have metabolic alkalosis. In this, pH increases, and because we are talking about metabolic, so it means bicarbonate. This pH will increase because of increase in the bicarb. Now, we have now learned about the acidosis, alkalosis, respiratory, and metabolic components. Now, sometimes people often confuse between what is compensated and uncompensated metabolic acidosis or metabolic alkalosis, or respiratory acidosis or respiratory alkalosis. So once you get to know about what is the meaning of compensation, you will understand this whole phenomena. Compensation means the pH remains normal. It means pH remains within the normal limit. But since if you're talking about metabolic acidosis, it means that something is disturbed in the metabolism, that is, it is in the bicarbonate. In metabolic acidosis, bicarbonate decreases. As you can see, it has decreased from normal value of 22 to 15 millimeter of mercury. It could be any cause, but to compensate that decrease in the bicarb, the PCO2 has also decreased from 35 to 45 to it has fallen to 22 millimeter of mercury. And because of both these two things, they balance each other, as a result of which the pH remains constant. This is known as compensated metabolic acidosis. Now, what is uncompensated metabolic acidosis? In uncompensated metabolic acidosis, the bicarbonate decreases, but there is no change in the PCO2, as a result of which the pH disturbs. The pH does not remain in the normal range, it also decreases, and this is called as uncompensated metabolic acidosis. And same is the case with the respiratory acidosis and respiratory alkalosis, which we will discuss in the next class. Also, in the next session, we will discuss about the what is partially compensated and what is fully compensated. Okay, thank you.